Welcome to the Grinders Table, the podcast where we sit with C-suite executives and founders who are taking their industry by storm to figure out how you can build an exceptional career and business. Together, we'll try to uncover how they are both defying the odds and what you can learn from their experience. Welcome to 2025. And this year we have a lineup of amazing people on the Grinders Table podcast. Our guest today is using artificial intelligence to solve one of Africa's most tragic healthcare challenges, which is the lack of reliable medical supplies. What actually started as a technical solution has evolved into a company serving thousands of healthcare facilities across 3 countries. And I'm sure there's so much more that our guest today can share regarding how well he has built his business. But before we go into the core of the conversation, Tobias, I'd like you to introduce yourself to the audience.
Yeah, thank you very much. Hi, everyone. My name is Tobias. I'm originally from Vienna, Austria, but I've been living in East Africa for more than 7 years now, mainly in Rwanda, but also in Kenya, DRC Congo, in Burundi, and I recently even spent more time in South Sudan. And I co-founded Viebeg Medical in 2018 when I saw this massive problem in healthcare, that a lot of healthcare providers are not data-driven when it comes to procurement. And in fact, buy everything based on gut feeling, which is very inefficient, especially in a remote area where it's hard to get access to quality medical products. This often leads to the lack of essential services, which can even result in death. So in fact, every minute 5 people are dying in the developing world, most of them in sub-Saharan Africa, because of diseases that could be treated if the right medical products were available. Yeah, so that's when I started Viebeg. Before that, I was already an entrepreneur working in fintech, but I wanted to do something more meaningful in my life, and that's how I ended up in Africa. And here I am, 7 years later, where we're working with more than 1,000 healthcare providers in 5 countries right now.
Wow, you've really done great in the last 7 years. Walk me through that moment where you became aware of, that problem, that medical supply challenge on the continent, and what actually caught your attention to it.
Yeah, so I initially came to Rwanda for my master thesis. I immediately fell in love with the country and then had the opportunity to visit a lot of health facilities. I actually went to more than 50. And I was struck by the inefficiencies in the healthcare supply chain, especially when it comes to medical equipment. I remember visiting a clinic that urgently needed basic diagnostic tools like blood pressure monitors, and the clinic was relying on outdated equipment that frequently didn't work, and that led to delays in patient care and inaccurate diagnosis. And when I wanted to know from the management of the facility about the procurement processes, I discovered that it was largely based on gut feeling, as I mentioned before, rather than on actual data. For example, they overstocked some equipment that they rarely used while facing shortages of other very important equipment. So that's when I thought, can we not use technology to solve this problem? And this is how we came up with the idea of building a procurement platform that captures procurement data, that takes into consideration public health data, demographic data, and the availability of health services in a specific region. And then that model, we call it our health demand simulation model, identifies equipment shortages in a specific location. And we even go a step further where we can then use this data to predict the profitability of an equipment in that region, which can be very important for a healthcare provider, even an NGO, if they want to become more sustainable. And with that, we have helped more than, as I mentioned, 1,000 customers right now to optimize their procurement decisions in East Africa.
Hmm. You're talking about being an entrepreneur. Was this in your grand plan, right after school? Did you think you were going to be an entrepreneur or did this just happen?
Unfortunately, I always wanted to become an entrepreneur. I wish I had, first maybe worked for a startup or potentially even a consulting company if I had taken a bit more time to develop and to learn and to see what actually works and what doesn't work. I started my first venture when I was 19. I was in college and I got into arbitrage trading. And back then it was, the first crypto boom, and you could do arbitrage trading with many different commodities. And this is how I got a bit into tech. And we built our own trading algorithm, and it made quite a good amount of money. And we had this lavish entrepreneur lifestyle. But then after a few years, I wanted to do something more meaningful with my life, and that's how I got interested in healthcare in Africa. So yeah, I kind of always had this dream to be independent, to build something that I can control, that is mine, that I can make a difference in the world, and whether that's a monetary difference, an impact, which we're doing now. Yeah, that's my story.
Yeah, it's an interesting perspective because I also hold the same view that for most founders, it would do them better if they worked for somebody or intern somewhere before they jumped into the arena. And I see this play out across the African continent. I meet so many African founders driven by vision, driven by need to solve something, but having absolutely no background in what they're trying to solve. Sometimes right out of school, that's the soft skills. Well, let's even go into that soft skills. So having been an entrepreneur outside the continent and then moving to Africa and trying to build a business, uh, how were you able to reframe your thinking around solving a problem and also leading people?
Yeah, I think it is quite different in Africa to operate as an entrepreneur in Africa than it is in Europe. First of all, the infrastructure, the technical technology infrastructure, but also the physical infrastructure. If you work in supply chain and hard to serve markets like the Eastern Congo, as we do, and then also it's very different in terms of culture, right? And as we all know, there is not just one Africa, many different countries with different cultures. And I see that all the time, that people work differently in Kenya and have a different culture than in, for example, Rwanda or even in Congo. And that was an interesting challenge for me in the beginning, but I had a lot of African friends even when I was in Europe. I was always interested in the culture of certain countries in Africa. It helped me, I think. The whole Ubuntu concept, I am because we are, if I recall that, if I cite that correctly. But basically, this community that you have to build as an entrepreneur, that your company is more like a family, a community, compared to maybe a more individualistic way of working in Europe. That, for example, if anyone dies in the family, the whole company would go and be to the funeral, would be there for the employee, would support them. That people also meet after work, and it's a very family-oriented way of working, I think, and I really enjoyed that. I've always enjoyed it because as an entrepreneur, you work very hard, and you might not have that much of a private life. But if you can also be friends with the people that you work with and you almost see them as a family, then, it's more fun basically to work with them.
As a leader of a company that is now scaling to various markets, right? People management, ops becomes more complex than it typically is. How have you been able to refine your decision making and leading people as you're expanding to new markets? Are there tips on how founders can go about it?
I think as you grow your company, you need to hire the right people. You need to get the right skills, people with the right skills, with the right experience. You probably can't run the same company that you've built with 5 people. If you want to expand to other countries, I think it is very important, first of all, to get people who understand the local market, so to have local talent, and to then upskill them if needed. There are a lot of young, talented people out there who are really eager to learn, who are eager to work hard. And that's, I think, the best approach, rather than maybe getting expatriates who, have to first learn about the market and then about the culture. So we very much believe in local talent. And then, you have to have very good project management skills, right? You have to be able to delegate work, to build a strong team around you. And then you have to look at the right markets also. There are challenges if you have, for example, English speaking team, and then you want to work in Francophone Africa, as we did, that can be very challenging. So you then need to find the right ways of communicating with that team, even if maybe they don't speak the same language, or there are language barriers. And we do that through technology. You don't always have to have a meeting with someone. Probably everyone who works with startups knows, different project management software or communication software like Slack, where you can really follow up with people, you can hold people accountable, and you can have a very smooth communication.
As you've scaled, what is one principle that you personally have that you've struggled to maintain?
I think for me, at least as an entrepreneur, it has been challenging to maintain the same level of perfectionism and efficiency. If you scale and you delegate a lot, I want to make sure that we can always perform to the level best. But if you now have operations in a very remote area with people that you might not have worked with before and that your team has hired, how can you ensure now that they perform the same level to the same extent as maybe the people that you have trained yourself, that you've worked with for many years? So I think that is a bit of a challenge to ensure that every department, every person at the company has the same skills, understands the vision of the company, and can communicate the vision to customers, even if they're very remote and never had this one-on-one interaction with the founder.
You've sort of mentioned something twice, delegation, and I know that delegation, especially for founders, can be quite difficult, especially because your business, that startup is your baby, right? You've sort of incubated it for years or for a while, and then it gets to a level where the business needs more people to operate efficiently, right? You can't do everything. At the beginning, you're a generalist, and then you have to start specializing over time. How have you managed delegation? Because it can be very tough for some people.
Definitely, yeah. I think, as you said, it is impossible to build a big company without delegating work, right? You can't do everything yourself. And I've seen a lot of founders really burn out because they have just tried to do everything themselves. And on the other hand, if you just delegate everything, that also can be a big problem, especially in the beginning. Let's say you as a founder have an idea, you build a technology, and you hire a salesperson to do the sales, then you might miss out on gathering very important information, customer feedback, right? I think a founder has to be involved with almost everything in the beginning to really understand the processes, to better understand the product, to get a lot of feedback from the market. But then as you grow, you need to somehow hand over your learnings to other people and even more learn from them, right? Ideally get people who are better than you in certain things. And that's what I've tried to do, and I think I have accomplished to do that. I found better people than me in every aspect, and now I can work with everyone and support them, and they support me.
Well, another thing I've also noticed is, and the reason I brought this up is because I just remember the conversation I had with a founder building in Ghana about 2 weeks ago. He's in a situation where he started out with really great people. They're still great and efficient, but for the stage of growth where he is, he needs to bring in people that are more specialized than they are. Have you ever had to deal with this situation, and how do you manage phasing out people from the business? What are your thoughts on this?
So this is a very difficult, thing to deal with as a founder, right? You might have a great team when you begin, and then you reach a stage where the people that have been with your company are no longer the people that you need now to take the company to the next level. They can be part of it, but you know they cannot. Somehow you need people on top of them, right? You need new people. They might have to report to the new people, and at least for me, a very difficult thing to do because they have been loyal and I really believe in taking this journey together and creating opportunities. But as a startup, you're growing so quickly that at some point, ideally, you have to hire top executives who have done it before, who've built other startups, and who understand it better than anyone else. So the way we've been doing it is, everyone who ever joined our company has always improved their social status and their professional life. So they've all learned a lot. They have grown as a person. They have earned more money, and a lot of them have either continued at gone to other companies and having a great career now and really saw our company as almost like a launch pad for their career. And the majority has actually stayed in our company, and they're still working in our company. They have now middle level management jobs. Some actually have become top executives, and they're earning now 10 times of what they've earned when they initially joined the company. And those are the things that I'm most proud of as an entrepreneur when I look at them. And I'm so grateful for all their hard work and that we've taken this kind of journey together. But yes, unfortunately, it doesn't always work out. And then sometimes you have to take some hard decisions and replace certain people. Because at the end of the day, a company is really a group of people who come together to make a difference. That's how I want to see it. As a group, you have to take the best decisions for the group. Unfortunately, you cannot always make everyone happy, but I think you can be fair. You have to be fair, and you have to create opportunities for everyone.
True, true, true. And I tell people that losing great talents is not a net negative because these people are actually your brand ambassadors. They might not work for you, but they probably would say great things about you out there and even refer deals to you. So it's not always a negative losing great talent. Now we're going to talk about technology in a bit, but your business is, combination of technology, AI. And we're going to talk about AI because everybody's talking about AI, people and then supply chain optimization. I like to talk about how you manage the supply side of things because that can get very complex, especially when you're looking at various countries. How do you approach that problem or that side of your business?
Yeah, so I think, especially in most African countries, where there are still infrastructural problems, like it takes 2 months to get products from overseas into the country, sometimes 3 months. At times during COVID when it took 7 months to get a container from China to a landlocked country like Rwanda. And I think there it is very, very important to be data driven, right? To use this new power that we all have because of technology, which is data, right? Everything that a hospital can collect, everything that a government can collect, that companies can collect, all this data, if you can put that together to make very smart, informed decisions, I think that is even more important in Africa than it is in continents where there are less supply chain issues. And so what we're doing is we're analyzing the demand for our products in each market. We're analyzing demographic data, public health data. In Rwanda, the Ministry of Health is actually co-developing our health demand simulation with Viebeg. So we have access to all the public health data. We know each region, each village, how many cases of each disease have been reported. What is the health burden there? We also know what kind of medical equipment is available in each region. And with that, we can take much more informed decisions, and we can help our customers to take more informed decisions. So that is how we're thinking about, supply chain and data. Obviously, with AI, what we're working on, which takes time. It took Google 10 years to build their AI. We want to focus now more on disease trends. I just spoke about the status quo. What equipment is available in a region? What is the health demand right now? But I think, right in these days where we have so much data, we should also look at, when we take decisions, we should also look at the future, right? How is the health trend going to look like? How will the demographic data look like? How many people will live in this sector in 5 years? What diseases will have based on, income data? If the income levels change, if climate data changes, right? If the climate changes, that all will affect diseases. And if the disease burden is affected, then the health demand is also affected, right? So this is how we're looking at artificial intelligence to really leverage the data that we have collected. We have data sets for 15 years in specific countries, and that can really help you to identify certain health trends, and then to work with big organizations which we partner with to really create an impact in the region, to really improve the health system in that region. And I can get into the details if you want.
You can, but you're talking about data. What's the most surprising data that you've stumbled across recently?
Unfortunately, I have to say the quality of the data has been most surprising. So that is the biggest issue that we're facing, that yes, there is data available. Often we can work with that data, but sometimes there is government data or even private sector data that is just wrong. And then that obviously can be a big problem because you, as a healthcare provider, take wrong decisions based on your data. And yeah, we've seen that a very big hospital in a specific region only reported 10 patients in a month. That just is impossible, right? So this is what we really want to work on with more governments in Africa, with more NGOs, with actually private healthcare providers, how they can better digitize their facilities, how they can capture data in a more accurate way so that decision making can also be improved.
Interesting. I will just slide into the whole conversation around AI. And I also very much agree with you, especially with the African continent, that we need to clean up our data, annotate the data, gather the right sets of data before we can start working on all the wonderful AI models, right? But I'm curious to see how you are seeing how AI is influencing the healthcare industry and how Viebeg is positioning themselves to be at the forefront of that.
I think the future of healthcare is AI. And there you have different sectors within healthcare, different categories. So obviously you have medical devices, which I think will be all AI powered, and we already see that trend right now as we speak. Right, there are a lot of AI enabled medical devices out there, and this is also what we focus on as a company. We don't only want to help healthcare providers know which equipment they really need, optimize their procurement, but we also want to bring to them the most innovative medical technology and then help them maintain it and also train them on how to use it, integrate with their existing software. And this is a very big trend, I think, in the future, and we very much focus on it. And as we just talked about data, the more data that we can also collect from some of those very remote areas where right now there is no data that is being collected sometimes. I mean, I just came back from South Sudan. I can tell you that there is no digitized clinic in remote areas. So, as you all probably know, AI has to be trained on data. So if there is no data available from this specific region, then it could be the case that the AI will not work as well on people coming from that region as it could be from other regions where there is a lot of data available to train to AI. And this is also called the racial bias. And so there, my dream, my vision would be to be somehow a gap or a bridge, a bridge for that gap, that we connect AI powered solutions to these remote areas in Africa, and bring innovation to those areas that lead to a better health outcome, but then also bring data from those areas to companies, ideally from Africa, that develop AI solutions. These solutions can now become more accurate with AI.
Going back to your story, right? And you find that quite enough people that play in the healthcare space, especially those that weren't necessarily born on the continent, are driven by some sort of altruistic motivations, right? They want to give back, they want to help. And now you're building in a space where you have to balance profit and social impact in a way, because again, it's healthcare to underserved regions. How are you thinking about it, and do you have to always reframe your thoughts, or do you have a framework on how you're balancing the two? Because again, there's this belief that if you're so indexed on social impact, profit making isn't going to be your goal.
Yeah, that's a very, very good question. So, I mean, I came to Africa as an entrepreneur, to Rwanda specifically, and then expanded, in the region. But I always had the idea that healthcare could be profitable, and I really enjoyed the impact that we're creating. And as I went to more remote areas where it's harder to be profitable, for me, the impact actually became more important. So it's a bit of a challenge for me to always balance impact versus profitability. And to give you a good example, we're now establishing 4 clinics in South Sudan. And, in order to really help this NGO to operate there, we have to lower our margins. And it's not a very profitable transaction, but a high impact transaction. So I'm really trying to build a sustainable company, and we have been profitable already. And there are years where we focus a bit more on expansion, and then we might not be profitable, but overall the company is profitable, can be profitable anytime. It just depends on, again, how much do we want to invest in technology, in innovation, and in reaching these very remote areas. So it is a very important trade-off. I think when you reach a certain scale, you can do both. You can really create impact and be profitable. And that is my biggest wish, my dream, my vision. I strongly believe that we will achieve that. I hope that many other tech startups will achieve it too, because you really need local innovators in Africa. I think that Africa cannot just rely on importation of medical devices, services, donations from outside of the world. I think we need to build a very strong local Pan-African health system. And for that, you need health tech software. You need medical devices that ideally are made in Africa. You need medicine that is made in Africa. And then you also need supply chain companies, distributors, ideally data-driven and digital, like Viebeg, who connect all these different players to the healthcare providers.
Amazing. You've all been listening to Tobias, founder of Viebeg, one of my favorite health tech companies building on the continent. We're going to be moving on to our rapid fire round, and it's just going to be short questions and responses from you, Tobias. And drum roll, here we go. What has been the most unexpected challenge in healthcare supply chain? Actually, you said it. I think your answer was something around data. Was that?
Yes, inaccurate data.
Yeah. Best advice received about scaling a business in Africa?
work with a local founder.
What has been your most valuable early mistake?
Raise too much money quickly.
Interesting. What's your favorite AI application right now?
Autonomous disease detection.
What is the most promising emerging African markets from your perspective at the moment? Everybody loves Ivory Coast. I think I'm just the only one that hasn't visited yet.
It's because of the food.
And finally, one book every entrepreneur should read.
Start with why.
Start with why. Why that book though?
Because I think as an entrepreneur, you have to have a purpose. I always say the purpose of life is a life full of purpose. So you need to be driven as an entrepreneur. You will have many challenges. And if you don't know why you're doing what you're doing and you don't have a bigger vision, a greater cause, it's much harder to go through everything that you will go through.
Thank you so much for spending time and talking to us. We're going to round up with a listener favorite from last season, which is power, money, fame, and pleasure. Which of them are most important to you and which of them is least important to you?
So the least important, I think, is money. That's what I've seen in the last 7 years when I worked in, as I mentioned, remote areas and lived in places where I didn't have access to running water and basic food sometimes even. It just showed me what is really important in life, which is happiness. The people that you're surrounded by. So probably pleasure to some extent. So pleasure in a way that you enjoy life, that you appreciate even little things. That should be the most important, at least to me. And the least important, as I mentioned, is money. Because if you do something well and you have a purpose and you're driven, then money will always follow.
If you had the chance to go back and redo your life, will you do things differently?
I think I would, because I think there's so many mistakes that I've made, which is normal. You know, when you do a lot of things, you also make mistakes, but things that I would do differently now. And I think at the end of the day, would have made things better, right? Viebeg, obviously, now with everything I've learned, I could do so much more if I do it all over again. But I wouldn't want to miss all the experiences that I had, whether they were good or bad. I'm very grateful for really everything, especially for my time in Africa. And so I wouldn't want that to change, but I think on the outcome, as you said, sometimes people go into something as an entrepreneur and they might not have the experience. If I had the network and the knowledge and everything, we could have been even the next unicorn by now. But I'm very happy with where we are. I think we've done a great job. And unfortunately, you can't learn this without actually doing it. So I don't think it's realistic to ask for it, but it definitely helps if you have, more experience and a bigger network when you work in a different country, in a different continent, and you're given a lot of capital to work with and you have to make very difficult decisions. It increases the probability of success.
All right. Thank you, Tobias, for spending time with us. This was such a great conversation and a good way to kick off the year. Thank you once again.
Thank you very much for having me.
This has been the Grinders Table podcast, bringing you unfiltered insights from Africa's most compelling founders and business leaders. If you had found value in today's conversations, here's how you can help us amplify these stories. Take 30 seconds to share this episode with someone in your network who's building, investing, or curious about Africa. You'll be amazed at how many life-changing connections start from a single shared conversation. And if you're feeling generous, a quick rating and review goes a long way. It helps more founders and business leaders discover these powerful insights. Until next week, keep grinding.